Thought disorders are unusual or dysfunctional ways of thinking. One form of thought disorder is called disorganized thinking. This is when a person has trouble organizing his or her thoughts or connecting them logically. They may talk in a way that is hard to understand. Another form is called thought blocking. This is when a person stops speaking abruptly in the middle of a thought. Disorders may appear as agitated body movements. A person with a movement disorder may repeat certain motions over and over. In the other extreme, a person may become catatonic. Catatonia is a state in which a person does not move and does not respond to others. Negative symptoms are associated with disruptions to normal emotions and behaviors. These symptoms are harder to recognize as part of the disorder and can be mistaken for depression or other conditions. These symptoms include flat affect, which is when a person's face does not move or he or she talks in a dull or monotone voice, lack of pleasure in everyday life, lack of ability to begin and sustain planned activities, and speaking little even when forced to interact. Cognitive symptoms, like negative symptoms, may be difficult to recognize as part of the disorder. Often they are detected only when other tests are performed. Cognitive symptoms include poor executive functioning, which means the ability to understand information and use it to make decisions, trouble focusing or paying attention, problems with working memory, which means the ability to use information immediately after learning it. Cognitive symptoms often make it hard to lead a normal life and earn a living. They can cause great emotional stress. Schizophrenia is caused by several factors. One of those factors is genes and environment. Scientists have long known that schizophrenia runs in families. The illness occurs in 1% of the general population, but it occurs in 10% of people who have a first-degree relative with the disorder, such as a parent, brother, or sister. People who have second-degree relatives, like aunts, uncles, and cousins with the disease, also develop schizophrenia more often than the general population. The risk is highest for an identical twin of a person with schizophrenia. He or she has a 40 to 65% chance of developing the disorder. We inherit our genes from both parents. Scientists believe several genes are associated with an increased risk of schizophrenia, but that no gene causes the disease by itself. In fact, recent research has found that people with schizophrenia tend to have higher rates of rare genetic mutations. These genetic differences involve hundreds of different genes and probably disrupt brain development. Other recent studies suggest that schizophrenia may result in part when a certain gene that is key to making important brain chemicals malfunctions. This problem may affect the part of the brain involved in developing higher functioning skills. Research into this gene is ongoing, so it is not yet possible to use the genetic information to predict who will develop the disease. Let's focus on eliminating the symptoms of the disease. Treatments include antipsychotic medications and various psychosocial treatments. Antipsychotics are usually in pill or liquid form. Some antipsychotics are shots that are given once or twice a month. Symptoms of schizophrenia, such as feeling agitated and having hallucinations, usually go away within days. Symptoms like delusions usually go away within a few weeks. After about 6 weeks, many people see a lot of improvement. However, people respond in different ways to antipsychotic medications, and no one can tell beforehand how a person will respond. Sometimes a person needs to try several medications before finding the right one. Some people may have a relapse and their symptoms come back or get worse. Usually relapse happens when people stop taking their medication or when they only take it sometimes. Some people stop the medication because they feel better or they may feel they don't need it anymore. But no one should stop taking antipsychotic medications without talking to his or her doctor. Psychosocial treatments can help people with schizophrenia who are already stabilized on antipsychotic medications. Psychosocial treatments help these patients deal with the everyday challenge of the illness, such as difficulty with communication, self-care, work, and forming and keeping relationships. Illness management skills help people with schizophrenia take an active role in managing their own illness. Once patients learn basic facts about schizophrenia and its treatments, they can inform decisions about their care. Integrated treatment for co-occurring substance abuse is because substance abuse is the most common co-occurring disorder in people with schizophrenia. Many people turn to nicotine, but ordinary substance abuse treatment programs usually do not address this population's special needs. When schizophrenia treatment programs and drug treatment programs are used together, patients get better results. Rehabilitation entails social and vocational training to help people with schizophrenia function better in the communities. Family education is important because people with schizophrenia are often discharged from the hospital in the care of their families, so it is important that family members know as much as possible about the disease. With the help of therapists, family members can learn coping strategies and problem-solving skills. In this way, the family can make sure their loved one sticks with treatments and stays on his or her medication. Cognitive behavioral therapy is a type of psychotherapy that focuses on thinking and behavior. It helps patients with symptoms that do not go away even when they take medication. The therapist teaches the schizophrenia how to test the reality of their thoughts and perceptions, how to not listen to the voices, and how to manage their symptoms overall. It can reduce the severity of symptoms and reduce the risk of relapse. Self-help groups are important because it's important for people with schizophrenia to have other people to talk to. Professional therapists usually are not involved, but group members support and comfort each other. People in self-help groups know that others are facing the same problems, which can make them feel less isolated. Once the patient learns facts about schizophrenia and its treatments, they can make informed decisions about their care and be more aware about their illness.